We are home to the second largest Cambodian population in the United States, and about half of our residents identify as being from the global majority. That's about 55,000 people. Coexisting with that incredible strength and richness are community health disparities across multiple categories. Systemic racism and the historical disinvestment in our community have exacerbated what we know as social vulnerabilities. And these things have made our health outcomes much worse. The CDC, Centers for Disease Control, the Social Vulnerability Index, sheds light on these key disparities on social determinants of health, particularly what Damaris just talked about, and the pastor on housing, transportation, and poverty. Our health center is located on a census tract that places us on the highest quartile for the index on social vulnerability at a 0.82. And we know that higher index scores are directly correlated with increased healthcare spending as well as poorer outcomes. Now, community health centers across the state of Massachusetts are innovating to tackle health disparities, and we are creating inclusive and integrated care models, all while balancing and tackling our workforce shortages that we're facing. As an example, we have a very special program at our health center called the Metta Health Center, and Metta is Buddhist Sanskrit for loving kindness and compassion. And that center offers holistic care to refugees and immigrants who have experienced trauma, including that of war and political unrest. As an example, we blend a global healthcare approach, providing primary care, behavioral health services, acupuncture, meditation, and community outreach. And our Metta patients demonstrate significant improvements in things like diabetes, depression, and PTSD. Now, the success of such program emphasized the crucial role of not only community health centers in this conversation, but also of our expanding of our care models, as well as fostering cultural proficiency, not only in healthcare, but within our workforce. Now, the Commission's report emphasizes the significance of supporting and investing in the healthcare workforce, and I happen to notice that there was a specific mention for community health workers and CHWs, and also the promotion of workforce diversity. So I will say this, that as a community health worker, we play an essential role due to our strong community ties, our unwavering empathy, resilience, our skills, our knowledge, and our profound respect for the communities in which we work. Building trust with our community, particularly with communities of color, involving them in the decision-making, as well as fostering a culturally proficient workforce are paramount in addressing the health disparities that we're talking about and ensuring the success of all of our initiatives and interventions. National studies have demonstrated that CHW programs yield an average savings of $2,245 per patient. These programs not only improve health outcomes, but have significant financial benefit. As an example, our asthma project at the health center that I've been very involved in with a cadre of different community health workers helps to improve living conditions for low-income families and asthmatic children, resulting in an 81% reduction in emergency room visits for all 239 kids in that program. The same is true for the older adults in our program, and I would like to share a story of Savannah. Savannah in 2017 came to us. He's a 71-year-old patient who joined our program, was struggling with uncontrolled asthma that frequently necessitated multiple urgent care visits and emergency room visits. The community health worker that was working with this patient recognized his own commitment to his health, but noticed that needed a little bit more in terms of an integrated approach. So the CHW provided him with a spacer for his inhaler, which made an immediate difference. And then from there, practical tools like a HEPA vacuum cleaner, allergen-proof bedding, and a very personalized asthma action plan. Now, years later, in this past month, actually, in October, the CHW and the patient reunited, and the patient was able to acknowledge the impact that this program had had on his quality of life, reporting that he now is enjoying time with his grandkids, is free from asthma attacks. And all of this truly demonstrated the lasting impact that equity-centered interventions have on our patients and our communities. The project's success, however, is due to our dedicated community health workers who conducted home assessments, educational visits, and provided these resources. Now, if we look at this one single intervention, this one asthma program, this could have net a savings to the healthcare system of over $500,000, $500,000. Now, despite all this evidence that we have, securing adequate funding remains a challenge due to the historical lack of reimbursement and investments in this space, which means that for us, consistent financial backing is needed, and our current support relies truly on a patchwork of grants from various sources to keep these programs afloat. So the Commission's report, to me, offers really actionable solutions for strengthening the workforce, connecting with communities, and restoring trust in healthcare, plus promoting thriving communities. And to me, it emphasizes in addressing social determinants of health, promoting innovative strategies, and investing in our healthcare workforce. The Health Equity Compact that I'm a part of and very proud of, the priorities also echo these recommendations, emphasizing investments in public health, in the workforce infrastructure, and our health equity zones, which really are meant to empower community-led initiatives in our communities. In closing, I will say, as one of our patients stated, she says, "I've had depression all my life, but thanks to the help and support I received at Lowell Community Health Center, I've been able to raise my children and live a normal life. I consider myself one of the lucky ones." So now it's 2023, and getting access to care like this shouldn't be about luck, especially in a state like ours that have led the way in advancing healthcare for so long. So I feel we have a moral obligation to address these disparities and inequities in health, and our state has the opportunity to lead once again. Our objective is to give everyone an opportunity at a healthy life, and I think everyone in this room would agree with that. And to make this happen, I do feel that we need to let go of traditional healthcare funding models and invest in doing things slightly different. And David, you had said earlier, and I echo what you said, that it's time to turn our awareness into impactful action. And to echo our community, we now need the courage really to make the necessary decisions to doing so. Thank you so much for inviting me to speak today.